Significance of high blood sugar and 8 diabetes. Symptoms 16. Indices of high blood sugar and 8 symptoms of diabetes. Most people immediately think of diabetes when the topic of health and elevated blood sugar is brought up. The body exhibits symptoms of extremely high blood sugar long before the condition is identified, despite the fact that it is a very hazardous and fatal one. The prevalence of high blood sugar is sharply rising due to the widespread consumption of processed and artificial foods in diets. The only way to stop this is to become informed and aware of the cues our bodies are giving us. This will enable us to stay. This will support our continued optimal health. Now, continue watching to learn the key indicators that indicate your blood type. Now, continue monitoring to identify the most crucial indicators that your blood sugar level is too high, as well as symptoms to watch out for if you suspect you may have diabetes. Before we start, remember to set on notifications so you never miss our new videos, and subscribe to our channel for more daily advice like this one. 16. Overdue urination or urinating at night. Overdosing on pee and nighttime urination. Granted, there's a strong chance you'll wake up in the middle of the night to use the restroom if you consume a lot of water right before bed. However, if your blood sugar is too high, you may get a urinary tract infection, which can cause frequent urination. 15th. Distorted vision, hazy vision. If you start to experience momentary blurred vision, don't freak out and go buy some glasses. The majority of the time, the swelling of the lens in the eyes is caused by elevated blood sugar. Do you see any of these symptoms? Do you suspect that you may have diabetes? So make sure to watch through to the very end, because when we offer you, we'll go over various symptoms of diabetes that you should be aware of, including indicators that your blood sugar level is too high. 14. Difficulty concentrating. The body cannot absorb glucose from the bloodstream into the cells when insulin is deficient. The body is unable to operate normally as a result. This explains why you feel worn out and find it difficult to focus. The body tries to eliminate extra glucose through urination when blood sugar levels are high, which can induce dehydration. 13. Dry voice, dry mouth. Your mouth gets dry due to elevated blood sugar levels, which also raise salivary and blood glucose levels. 12th. Impotence. This disorder, which only affects men, is a result of inadequate long-term blood sugar regulation. The blood vessels and nerves are harmed by this. 11th. Recurrent illnesses, recurrent infections. It is necessary to keep an eye on a number of recurrent infections. Additionally, keep an eye out for extreme elevation of blood glucose and several pancreatic disorders. 10. Slow healing injuries. Slow healing wounds. Elevated blood sugar levels may be the reason for minor wounds and bruises that heal more slowly than usual. It can cause poor blood circulation and nerve damage, which makes it difficult for blood, which is necessary for skin repair, to get to the injured area. 9. Stomach PI. Stomach issues. Food may take longer to pass through your stomach if your blood sugar is elevated. Bloating, distension, stomach pain, nausea, or vomiting may result from this. Permanent sluggishness or extreme fatigue. 8. Constant fatigue or extreme tiredness. You are likely to experience feelings of exhaustion, drowsiness, or depression if your thyroid function is low. It requires energy to fight infections, which can lead to persistent exhaustion and elevated blood sugar levels. Thrust 7. Thirst. Your kidneys have to work harder to filter and absorb more sugar when your blood sugar is elevated. Liquids must pass through the body in order to urinate the sugar in order to accomplish that. Dry as well as 6. Dry and itchy. Skin. Itchy skin results from inadequate blood flow throughout the body. The bottoms of your legs are the body parts that itch the most frequently. 5. Infinitely hungry, always hungry. It's okay if you have a voracious appetite. You might be among those individuals. However, if you typically don't eat a lot, it's possible that you're deficient in an incretin hormone. Following a meal, Incretin decreases the amount of sugar released from the liver. This hormone causes your meal to empty more quickly and makes you feel hungry again soon after dinner, which raises blood sugar levels. Additionally, you might observe the formation of thick black patches of skin on your hands and the back of your neck. 1. Numbness and tingling. Nerve injury and tingling and numbness go hand in hand. You may have high blood sugar if you feel tingly or numb in particular parts of your body. The term neuropathy refers to this kind of nerve damage. Fourth axis, abdominal weight fat. One of the most typical indicators of elevated blood sugar levels is this. You feel hungry again because some of the food you ate was not able to enter your cells as energy that would have sustained them. 1. Nerve difficulties. Nerve issues. Put simply, having high blood sugar can harm the blood vessels that supply the nerves with nutrition and oxygen, which can result in nerve issues. Observe the following symptoms to determine if you have diabetes. 8. Hunger and fatigue. Hunger and fatigue. Your cells use glucose, which is produced from the food you ingest, as energy. But your body needs insulin to achieve this. WebMD claims that energy cannot reach the cells if the cells reject the insulin. You are therefore devoid of energy. 7. Common urination. Regular urination. In a 24-hour period, a typical person urinates 4 to 7 times. Over a 24-hour span, the average person urinates 4 series. According to WebMD, this happens as a result of diabetes raising blood sugar levels. The body may require more fluids to maintain its blood sugar levels if the kidneys are unable to do so, which increases the amount of urine produced. 6. Loss of weight loss. According to the Mayo Clinic, you lose calories along with sugar when you urinate frequently. Diabetes may also make it more difficult for sugar from food to enter your cells. When combined, these two can result in weight loss. 5. Dry mouth. Your body utilizes a lot of fluids when you pee. Therefore, there is less moisture for other things if you urinate a lot. According to WebMD, this can make you dehydrate and possibly have dry mouth. 4. Blurred vision. Elevated blood sugar can cause your eyes and other tissues to lose moisture. According to the Mayo Clinic, diabetes can damage existing blood vessels in your retina and result in the formation of new ones if unchecked. 3. Cuts do not heal. Over time, blood flow might be impacted by high blood sugar. Breakage is not healing according to WebMD. This may result in nerve damage, which will hinder your body's ability to repair wounds. 2. Tingling in the feet and hands. Tingling in the hands and feet. According to the Mayo Clinic, high blood sugar levels can harm nerves. Hand and foot tingling and pain can be caused by injury to the nerves. 1. Dark spots on 52 skin areas. Dark spots on skin. According to Everyday Health, diabetes is indicated by acanthosis nigricans, a skin disorder that causes dark spots on skin, usually on the neck or armpit. The CDC estimates that 30.3% of Americans suffer from diabetes. In the U.S., 30.3 million people have diabetes. This comprises 7.2 million undiagnosed people and 23.1 million diagnosed people. A whopping 23.1 million diagnosed and 7.2 million. Additionally, according to the CDC, 33.9% of Americans have prediabetes. In the U.S., 33.9% of people have prediabetes. Having said that, it's critical to identify diabetes' early signs. The problem is that the majority of individuals choose to ignore the early signs of diabetes since they are so slight. The trouble with this is that long-term harm is typically the root source of issues when they do arise. Do you have diabetes or elevated blood sugar? Are you diabetic or have high blood sugar? How can you know if your blood sugar level is too high? Can you indicate that your blood sugar level is too high? And how can you make sure your health is in proper working order? What are some actions you take to maintain a good state of health? Let us know in the comments section below.